Good evening and welcome to Ibis Productions Presents. I'm your host, Gonzalez-Arguinzoni. We've got a great show for you. Before we get started, I just want to take you on a short tour of Vancouver, BC. It's a wonderful place. Everybody should go and visit. It's great. We're definitely going to make a good attempt to try and examine all of the body's systems in this show. It's only a half-hour show, so let's get to it. What about blood flow? The blood has to be carried through something. And it's absolutely amazing to see how many miles of arteries and veins are in a body. Now, here's your chance to see it as well.
Oxygen is distributed throughout the body in the bloodstream by the heart. The heart is a hollow muscular organ which keeps the bloodstream constantly flowing. It pumps around 70 milliliters of blood per beat, around 70 times per minute at rest, and when exercising or running, even faster. In a human life comprising 75 years, that makes roughly 2.5 billion heartbeats. When a heart is opened longitudinally, we can look into all of its chambers. Here we can see the muscular left ventricle, next to it, the right ventricle, and the two upper chambers or atria above. The left ventricle pumps blood to the body's circulatory system. The right one pumps it to the lungs. Cusp-like atrioventricular valves extend between the ventricles and the atria to prevent blood from flowing in the wrong direction. In this heart, the mitral valve has been replaced with an artificial valve. The heart and the blood vessels comprise the cardiovascular system. It ensures the transportation of oxygen, as well as vital nutrients and hormones to the individual organs, and also the removal of waste materials. The network of blood vessels is exceptionally dense. If all of the blood vessels in a single human body were laid end to end, they would wrap around the equator twice. The blood vessels that supply oxygen and nutrients to the myocardium are called coronary vessels. Here the left coronary artery has been dyed yellow and the right one red. Should the flow of blood in an artery be interrupted, the muscle fibers affected will no longer be supplied with blood and will die. This is called an infarct or heart attack.
Have you ever known anybody who taps and has a nervous twitch and is constantly doing something that possibly drives you crazy. Well, I've often wondered, what does my drummer's nervous system look like? All that tapping, it's got to be an overload. Here's your chance to actually see human nervous system.
A fine network of nerve fibers extends from head to toe. These nerve fibers monitor and regulate all of the bodily functions. They emerge directly from the brain or from the medulla oblongata and branch out to the rest of the body in ever finer nerve fibers. They transmit information in the form of weak electrical signals. The brain is the body's control center that regulates every thought and nearly every movement. It processes sensory impulses and enables us to have consciousness, feelings, memory, and language. This exhibit has been given the position of a pensive chess player because it shows how the human organism has been innovated. The pose is intended to highlight the particular character of this plastinet, its anatomical identity. The aesthetic impression we get is indeed intentional. The reason is that the results of plastination should at the same time appeal to both the mind and the emotions. That is, it should impart knowledge and awaken in us an awareness of nature. In this opened cranial cavity, we can see the cerebrum. Below it, the cerebellum, which is responsible for coordinating our movements and our sense of balance. The spinal cord is connected to the brain. The peripheral nerves emanate from the spinal cord and extend from there to the muscles. From the lower part of the spinal cord, the sacral nerves run down to meet in bundles to form the sciatic nerve. This in turn extends over the ilium and along the posterior part of the thigh, where it branches again in the popliteal space behind the knee. When we fold back the cheekbone and temporalis, or temporal muscle, we can see the cranial nerves emanating from the brain. Here is the trigeminal nerve as it leads to the eye, as well as to the upper and lower jaws. It also supplies the mucous membrane of the upper jaw orifice, shown here exposed, which is often a source of inflammation. The brain lies in the cranial cavity like a walnut in its shell, completely protected from mechanical influences on all sides. Just under the cranium there is the cerebral cortex, whose numerous convolutions and recesses extend well into the white matter. In a cross-sectional brain slice, the grey matter of the cerebral cortex and basal ganglia can easily be distinguished from the white matter. Grey matter consists of nerve cells that emit and process impulses. White matter is nerve tissue, consisting chiefly of nerve fibers. Inside the brain there is a complex system of cavities in which fluid circulates. Here, beneath the corpus callosum, we can look into the right lateral cavity and the third and fourth ventricles. This fluid serves as a shock absorber to offset the jolts to which the brain is often subjected. When normal flow is obstructed, the fluid congests in the ventricles and causes them to become distended. With babies, such obstructions can also cause the skull to enlarge abnormally, because at this age the sutures of the skull have not yet completely ossified. In such cases, it is referred to as water on the brain, or hydrocephalus. The obstructions are usually caused by congenital malformation, inflammatory processes, or, as in this case, by tumor growth. The brain only accounts for about 2% of total body weight, but it requires 20% of the total blood supply. If the flow of blood to the brain were to be interrupted for only 10 seconds, we would lose consciousness. In this brain, we can see a massive hemorrhage resulting from a stroke. The blood permeates the brain matter, and in conjunction with the region affected by the stroke, dysfunctions can occur, such as loss of speech or paralysis. Should vital centers be affected, a stroke can also be fatal. Strokes account for 15% of all deaths. On this frontal brain slice, we can also see a massive deep black hemorrhage caused by a stroke, especially on the right hemisphere.
Here's one of the things I've always wondered. What does an artificial joint look like in the body? Most of us have never seen one at all, but today you're going to get a chance to see one inside the human body.
An essential vital function of the body is movement. It is made possible by our locomotive system, which consists of bones, muscles, and joints. The bones taken as a whole, namely the skeleton, form the internal framework of the body. With its more than 200 bones and 100 articular joints, it provides the body with stability, support, and flexibility. Each joint is enclosed by a membranous capsule that stabilizes it. We can find cartilage wherever elasticity is required by the skeletal system, for example in the area of the sternum. Here the cartilage permits the rising and falling movement of the thorax during breathing. The surfaces of joints are also covered with cartilage. This reduces friction. Here we see a bent knee joint. The surface of the cartilage is as smooth as glass. If we look deeper, we see the cruciate ligaments. Here the outer collateral ligaments, and here the inner and outer meniscus. If the joint is arthritic, the cartilage will be increasingly lost, either through inflammation or wear. This knee joint already shows severe signs of abrasion on the articular surfaces. Knee and hip joints are especially prone to arthritis because they're subjected to stress caused by an individual's body weight and to severe wear during the course of a lifetime. In more extreme cases, a worn-out joint can be replaced by a prosthesis. A prosthesis is designed to emulate the natural joint in form and angle of inclination. It is cemented into the bone by means of a long shaft and is usually made of stainless steel, titanium or Teflon. Nearly every bone has a hard, compact outer zone or cortical substance and a core of spongy bone or trabecula. The latter is configured according to physical demands and forms lines of tension depending on the force of pressure and contraction. This structure lends bones substantial stability while at the same time remaining lightweight. The human skeleton only weighs an average of 10 kilograms. Nevertheless, it is stronger than reinforced concrete of the same size that will probably weigh 4 to 5 times as much. Bone fractures can heal well thanks to the unique capacity of bones to regenerate. However, to mend properly, the bone fragments have to be securely immobilized so that they cannot move. For this reason, with bone fractures, stainless steel screws, wires and plates are frequently used to join the fragments firmly, as can be seen in this exhibit. Surgical spreaders serve to keep soft tissue away from the bones during an operation. With complicated fractures, external fixators are used, such as shown here in the lower leg and here in the wrist section. The screws are secured to the bone through the skin. On the right side of the chest, we can see a pacemaker. The electrode of the pacemaker is inserted from behind the collarbone into a vein until it reaches the heart, where it is secured. At the back of this specimen, we can see an operation on the spinal column. 2 neighboring vertebrae have been fused together with the aid of screws and connection pieces. Such surgical procedures are sometimes necessary with slipped discs. Bone disease can affect the entire organism. This severe deformation is usually caused by a hereditary dysfunction of bone formation. The internal organs have to adapt their shape and dilation to the unusual form of the torso. Contractions exerted by individual muscles that are attached to the bones set the skeleton in motion. These two specimens stem from one and the same body. The skeleton has been removed while the muscular system has been displayed separately. Skeletal muscles generally have a broader, more fleshy origin and bridge one or more joints from one end to the other. They transmit their pulling power to the bones via strong, inelastic tendons. This body shows once again the two systems of the locomotive system separately from one another, namely in one half of the body the muscular system and the skeletal system in the other half. Moreover, this half allows us to see the internal organs. We can clearly see that the lung has been blackened by years of smoking.
Now here's one of those delicate subjects that you have to decide, do I really want my kids to know this or not? But in the way this is presented, I think that it's acceptable for children of any age, but that'll be up to you. But if you want to take a quick moment to get the little ones out of the room, we're going to discuss the reproductive system. So, you decide.
The internal organs of the body also include the urinary system and the internal genital organs. Both systems of organs have been incorporated in the urogenital system, owing to their close anatomical and functional relation to one another. Here we can see the kidneys on either side of the spine, with the renal pelvis that empties into the ureters, which in turn lead down to the urinary bladder in the pelvic cavity. In males, the prostate gland is situated beneath the bladder, which encircles the urethra like a ring. Here it has been exposed lengthwise and shows the passage of the urethra. The prostate gland tends to enlarge with increasing age, which constricts the urethra and sometimes causes problems with urination. Kidneys play a key role in controlling water levels in the body and cleanse the blood of dissolved waste matter. The total volume of blood in a body flows through the kidneys approximately 15 times per hour. Blood is filtered in the renal cortex. Urine is concentrated in the medulla, from which it empties into the renal pelvis. There are numerous kidney diseases that can cause severe functional disorders. This kidney has been pervaded with numerous cysts and is significantly enlarged. Both symptoms were caused by a hereditary disease. In contrast, this kidney has been severely atrophied as a result of chronic infection. Such severe cases can only be helped by regular hemodialysis or a kidney transplant. Female reproductive organs are largely contained within the body. They include the two ovaries. the 2 fallopian tubes, and the uterus. With each monthly cycle, an egg matures in the ovaries and is then captured by the funnel-like end of the fallopian tubes. Fertilization normally occurs on the way to the uterus. The egg then nests itself into the mucous membrane of the uterus. In this specimen, we can see once again the internal female genital organs, shown separately. In the middle, we can recognize the uterus. It has been cut open horizontally. We can recognize the fallopian tubes and the ovaries on either side. On this enlarged uterus, we can see several small growths called myomas. These are benign tumors resulting from uncontrolled growth of muscular tissue in the uterine wall. Myomas are quite common. However, in most cases, they do not cause any problems. Female breasts are also included with the external genital organs. Outside of pregnancy, they consist primarily of fatty tissue, as can be seen here on the left of the picture. The network of glandular ducts is so fine as to be scarcely visible to the naked eye. On the right, we can see breast cancer. Its hard tissue has almost completely infiltrated the breast.
Remember that you're mortal. This is suggested to everyone who attends the exhibition, especially by the Gestalt plastinates themselves. I was what you are. You can become what I am. And that brings us to body donors. The people who are exhibited here made a very conscious decision during their lifetimes to be available to the next generation for the sake of anatomical instruction. First, people attending the exhibition should get a clearer idea of their own bodies. We live in an artificial world. Normal persons are no longer conscious that they, themselves, are nature. Secondly, the intention was to present anatomy in a very concrete way. This exhibition is not about art or science, it's about instruction. Instruction in the fullest sense of the word, in that people attending the exhibition can realize their own vulnerability. In a prophylactic sense, since if people see how unhealthy habits or lifestyles concretely affect their own bodies, for example, smokers' lungs, heart attacks, or meniscus damage, it will help them to gain a greater appreciation and perhaps a renewed sensitivity toward their bodies. My models are the Renaissance anatomists who pioneered the initial enlightenment in this field, Leonardo da Vinci and Andreas Vesalius. For the first time, they discovered the beauty of bodily interiors at a time when the beauty of bodily exteriors was the focus of an entire artistic epoch. In the late Middle Ages, Andreas Vesalius was the first to assemble a skeleton. He literally took it from the grave and returned it to society. I see myself in this tradition, and I am continuing it with the possibilities of plastination. By making it possible to solidify soft tissue, plastination permits bodies to be exhibited not only as skeletons, but also as skeletons with muscles and organs at the same time. And I do not display people as incomplete specimens. I do not use dissection to remove organs. Instead, I provide insights into bodily interiors. People can look inside. This only becomes possible when I can visualize partitions into the body or gaps in structures that are aesthetically worthwhile and instructive, and then expand the resulting fragments, open them like bodily doors, or even move them around in relation to one another. The resulting images of man, the unusual bodily forms, are thus a necessary consequence of my instructive efforts, but not their objective. A plastinate is a success for me when it's aesthetic, dynamic, and instructive. Aestheticism and dynamics foster instruction. Vesalius and Leonardo da Vinci both considered their specimens to be art in the sense of craftsmanship. What I show here is at most anatomical art that I wish to define as the aesthetic, instructive presentation of bodily interiors. Anatomists in the late Middle Ages made the autopsia, that is, seeing with one's own eyes, the basis for all science. Laypersons have retained a fine sense for authenticity, and they have a craving for it. One model looks like the other. An authentic human specimen, however, is representative of a very individual life. Laypersons have a right to view the human body so that they can form an impression of its anatomy, so that they can genuinely comprehend the body in the true sense of the word. This exhibition has been consciously made for laypersons. The reason is that laypersons are the partners of today's physicians. Consequently, they have to be educated about the human body, and they can only receive this education when they look inside genuine human bodies, just as physicians were able to do during their studies.
That's all the time we have for the show. I hope you enjoyed this installment of Ibis Productions Presents. Don't forget to check out Ibis TV on the net. Okay. Cut.